Doctors of Reddit, what happened when you diagnosed a COVID-19 denier with COVID-19? Family members have come in with the sick family member and lied about exposure and/or symptoms, despite the members testing positive. This has lead to inappropriate management, delay in treatment, and exposure of staff and other families. The family members then get angry when told to isolate. Edit typo. I have treated a young male in our ICU with critical COVID-19 with severe diabetic ketoacidosis. He did not believe in insulin. Yes, you are reading this right, or other antidiabetics. Even though insulin is inexpensive in our country, he tried to treat his type 2 diabetes with herbs. His HbA1c, the lab value showing the state of his diabetes on the longer run, was off the roof. He did not vaccinate, he was offered, did not wear a mask, did not distance, and did not believe in any of this corona bullshit. Most of this information was obtained from his 20-year-old daughter, as he was quite disoriented at presentation and was intubated urgently. She was sobbing through the phone every day for 1.5 months until he died. I held the phone with his daughter on call to his ears multiple times when he was still intubated, but his mind cleared up and his sedation was optimal. I was quite convinced that he realized his mistake on the ventilator, with lines and tubes inserted into his body everywhere, and in his last clear moments, when his mind allowed. But I cannot be absolutely sure. I often think about the last conversation and last mental images people have before their death. They just kept denying they had it, stated they had something else, and tried to leave against medical advice while on high-flow nasal cannula, which we didn't let him do because he would have died within minutes. Before he was admitted to the hospital, he was symptomatic but refused to isolate at home. He gave it to his wife, who ended up in the ICU. My wife and I travel for work, and she happens to work in medical labs, usually large hospitals. I've been shocked by the sheer amount of lab techs and the like who refuse to wear masks and nonchalantly go about life as if COVID weren't real. I'm a doctor working in acute internal medicine. I've seen lots of COVID over the last 12 months, probably 300 plus cases. The one that sticks out in my mind the most was a 70-year-old lady with COVID. She refused to have a vaccine because she didn't trust it, despite the fact she was eligible for one for weeks beforehand. In the UK, subsequently caught COVID and was admitted to hospital. She repeatedly doubted this was the diagnosis. She refused to go to our COVID high dependency unit despite quite significant respiratory failure. Of course, she deteriorated over a number of days to the point where she was on maximal oxygen on the ward, and at that point finally accepted treatment in HDU with high-flow oxygen. Although continued to doubt she had COVID, died within 24 hours of her HDU admission, having refused to go to ICU. And of course, what did her family say? They were convinced she never had COVID and even went as far as accusing us of withholding life-saving treatment from her. Unfortunately, there's no treatment for stupidity. Edit spelling. Didn't diagnose a denier, so not exactly this, but did have a patient refuse testing upon admission and aggressively yelling COVID is a hoax. I calmly said, "Okay, nurse. Since we won't know his status, please admit him to the COVID floor." He became a believer in an instant and requested to be tested. Doctor here. I diagnose people with COVID on the daily. Some people are actually really great about it, others are more difficult. I'll tell you a tale that occurred during my most recent shift. Back-to-back rooms and patients. Patient A, in room number 4, is a 23-year-old male, no medical history, comes in with body aches, malaise, and fatigue, also had some mild nausea without abdominal pain or vomiting. Patient B, in room number 5, is a 51-year-old female, medical history of intermittent asthma, so she uses a puffer and frequently comes in with shortness of breath, has some possible fevers at home. In triage, it was noted that this patient's oxygen sats were in the 88 range and her heart rate wasn't elevated. Interestingly, when asked if she thought she had COVID, she said, "I can't have it. I tested negative 2 weeks ago when my son tested positive. He's been sick at home." You guessed it, both people COVID plus. Patient who went home, "He's doing great," was extremely remorseful, and before he'd even left the ED he called his work to let them know he was positive and to get everyone there tested because he figured he had gotten the illness at work. He worked in a small family-owned warehouse as a foreman. He also called his parents and they were getting him set up to sleep in the garage until his quarantine was up. "I respected this guy." Patient B got admitted to the hospital because her O2 sats weren't great. When I went back to tell her she was COVID plus, she called me a liar and told me I must have made a mistake. She threatened to sign out AMA against medical advice. But when she got up to leave, she got so short of breath the nurse used that to convince her to stay. People are strange sometimes. I try not to let stuff bother me, but COVID deniers come very close to crossing that line. I'm an ODP and work alongside anesthetists in theaters and ICU. To be honest, I've not really seen anything from patients regarding outright denial. However, I have seen some of my friends on Facebook who have spouted all sorts of lies. That's really disappointing to say the least. One of them, a friend of my wife, works at the hospital. She works in admin and refuses to wear a mask and even bought some certificate off the net so she doesn't have to wear one in public. Anyway, that's being escalated up the chain of disciplinary action. I work on a COVID unit and I ran into a patient like this. They'd tell me over and over again about how they weren't really sick and about how I didn't need to be gowned up in PPE. They even tried to take my face shield off. If you test positive for COVID 2 times then you have COVID. People are crazy. My wife's a nurse, just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE like gowns, goggles, etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 15 minutes and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test. I'm an anesthesiologist, and in our institution, we're the ones tasked with intubating COVID suspects, positive patients who would otherwise die without ventilatory support. And holy hell, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors used to label random patients to mooch money off them. Some of them scream at us, in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with CO fever and diarrhea. The child was severely dehydrated and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was the child never left the house. It's just I and the father who go to work daily. The grandmother babysits while we are away. How can he even get COVID without leaving the house? She had called her husband. He came with 10-15 relatives in a car. They broke a few chairs and then left with the baby. We just informed about the case to the COVID control center. Not a doctor, but when my grandmother was dying, my relatives kept pushing me and the doctors to say what it really was. It added so much stress to an already difficult situation and was embarrassing as well. Even after she died, they kept saying things like, What if it was a stroke and she was misdiagnosed? Don't you think they just didn't want to help her? I was trying to arrange with hospice to go in and say goodbye, and my stupid second cousin was sending me YouTube videos about how COVID is fake. I was already not close with these people, and I am glad they are out of my life now. My mom works for an obgyn who specializes in high-risk pregnancies and births, and he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth, but she insisted it was a hoax and ended up checking herself out AMA, but not before she spat in the face of the nurse, who coincidentally had just completed chemo. That was near the beginning of the pandemic, and I'm so curious what happened to that lady. The nurse is okay, thank goodness. I ran here with most of 2020 spent in COVID land. I never had anyone refuse treatment when things got serious. I know some of the MDs I worked with got yelled at, like the rest of us. But honestly that happens frequently anyway. Some denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care. One story stands out. Last summer a guy came to the ED with symptoms and tested positive. He refused admission for the classic list of reasons: it's a complete hoax, and even if it's not a complete hoax it's not that big a deal, I'm strong enough, etc. Couple days later he was back in the ED with his mom, who he lived with and who was now also symptomatic. They were both admitted and eventually put on ventilators. Guy lived, but his mom didn't. Not a doctor, but nurse that worked in one of our COVID ICUs. Lady was intubated, sedated, prone to therapy that involves lying the patient on their stomach in order to oxygenate the lung more effectively, reserved for very sick COVID patients. The whole shebang. Miraculously she recovers and is weaned down to high-flow nasal cannula, still a fairly high oxygen requirement, but better than needing the breathing tube. This spiteful she-devil would purposely cough on us nurses as we went into her room to give meds care, simultaneously yelling that COVID isn't real, and that we gave her COVID. God, this winter sucked. I'm a student, funeral director, and I see families go to the funeral of someone who died of COVID-19 and still deny it. They started out shrieking at the doctors to change the cause of death on the death certificate. Now FEMA is helping with funeral expenses for COVID deaths. Suddenly there's changes of heart. Nurse here. I had COVID and now I'm in rehabilitation because my lungs are at 70% capacity. Now, I was at 40% capacity, and now when I hear someone say that, I have the urge to slap them with a chair. I will need another year until I'm fully recovered. I've been confrontational to these patients out of respect for my ICU colleagues and nurses. They put their lives on the line for stupidity. Essentially I ask all these patients to cure heart disease, stroke, ulcerative colitis and Crohn's since they've figured out COVID is fake. I asked them if they have any thoughts on recent stenting medications or immunomodulatory meds, if they're aware of any medications down the pipeline since they're ahead of me and have more knowledge than me. I also asked them how well they did in math in school so I could better understand probabilities. Not a doctor, but my wife is and a few of our family friends are as well. One of them is sports medicine. Family. The guy came in, refused to use a mask. Our friend refused to treat him until he masked up. He had a newborn at the time too. When our friend told him he most likely has COVID, he needs to go to Tampa General immediately for testing and treatment. The guy said no, it's fake, he just needed some antibiotics. He left without getting a prescription, called back that night, demanded to be given oxygen. Our friend told him his only option was to go to the hospital. Guy had a severe case of COVID and ended up being hospitalized for a few weeks. He still thinks it was fake and was only a severe flu. Doc chiming in. They told me I was wrong. Obviously, there's no way they had COVID despite coming into the for shortness of breath, cough, and fevers. When I mentioned that their wife, who was several rooms down, also had COVID, the response was, "Oh, that makes sense because she always gets sick." When I asked how it made sense that they wouldn't have COVID with the same symptoms, I was told that it was because they were overall healthy and only took their mask off to eat and drink in the casino. I'm an nurse in Detroit and it's been rough. This is especially true now that we're surging again. It's the same thing over and over. They won't get the vaccine, they won't wear masks, they won't stay home. People like me are the problem. I'm the one who lives in fear, so I should stay home. Some of them are my co-workers. When it comes to public health, these people are the equivalently the welfare queens they hate so much. They take and benefit from herd immunity without a thought of contributing to its stability. Couple in their mid-60 years, very rich. They came with all symptoms, screaming COVID-19 don't exist. For them, it was a flu. Drink hot tea with lemon and honey at home. Some Advil for fever. Everything will be alright. Refuse to be hospitalized. Try to sue the hospital with their army of lawyers. It was in June 2020. They signed their papers. Go home. Come 2 days later on the hospital. Dead. Their son was in Japan. Never come to reclaim body. He just called to confirm the death of his parents. End of the story. Not a doctor but a respiratory therapist. We had a patient, mother of 3, on FaceTime with her boyfriend denying it was real right up to the moment we intubated her. Guess who ended up with the great peg and never came off a ventilator till she died? Not a doctor but work in the psych area of the emergency department. Needless to say, there's a lot of psychiatric illness-based COVID denial and or paranoia. Patients often refuse swabs thinking we are trying to implant microchips. I only bring up my experience to contrast my psychiatrically unwell COVID-denying patients to the psychologically unfit COVID-denying population. One is because of brain chemical imbalances and the other due to propaganda, politicization, and poor critical thinking skills. It's interesting that the outcomes are similar, if only in this respect. Not a doctor but I work at an urgent care that does COVID PCR testing. This lady tested positive and for the entirety of her mandatory quarantine time would not stop calling the clinic. She insisted that we were running some scam by reporting positive tests to the IRS and getting kickbacks. We don't report to anyone besides the state and even they don't do much. I honestly felt bad for her. She was an immigrant that was working as a nanny under the table and got fired for getting sick. She felt super alone and didn't know how to go about dealing with her situation. As someone who contracted COVID myself, I understood her frustration. You feel like you just got handed this test result, your life stops, and you're still expected to pay rent, groceries, etc. Definitely doesn't justify her denying a very real virus, but still sad. Horrific story heard from a friend who is in the air. Family comes in and wife and father are both extremely sick with COVID. The family had a Thanksgiving party with their friends and relatives. Entire family admits they have no idea why their parents are sick because no one was sick at the party. Siblings can't make up their mind with their parents and both mom and dad die in isolated rooms. Grieving family decides to go out to a restaurant to be together. Lessons learned? Nope. Medical spouse here. Husband works as a hospitalist in a rural hospital 1 week a month. He went to help in the RBC. They had patient that needed to be tubed who was COVID positive but didn't believe in COVID. The patient's oxygen level got below 70% or 60%, or whatever severely hypoxic is. So they told him he needed to be intubated. The patient screamed at my husband that he was lying and that if he tubed him he'd sue. Husband asked if he could do it if the guy stopped breathing and the dude said well that's different. So he waited 15 minutes for him to pass out from lack of oxygen and then intubated him and walked out. I work in psych and the biggest issue has been people requesting letters stating they don't have to wear masks because of anxiety. I absolutely will not write such a letter, and the amount of times I have had to explain that not only to a PT but to therapy staff who feel so bad for the PT is astronomical. I always give a detailed reason why, but I know no one is listening once they figure out my answer is number.